Hi everyone, thank you for participating in Lecture 8 of this course. By now, you should know me, but I'll reintroduce myself. My name is Chaya Merrill, and I'm a co-instructor for this course. I work with Dr. Perry Payne in the Community Engagement Research component of the Clinical and Translational Science Awards. I'm with Children's National Medical Center, specifically within the Child Health Advocacy Institute, the CHI, and my department is the Child Health Data Lab. In Lecture 8, what we're going to be talking about is sustaining community partnerships with a special focus on dissemination of information. In your reading for this week, the authors clearly point out the many challenges in sustaining community partnerships. I've highlighted the key ones on this slide. Please make sure to read the case studies that the authors provide that illustrate how specific community initiatives were able to overcome many of these challenges. The common challenges include engaging and maintaining community involvement, overcoming the differences between academics and the community. Often this shows up in subtle ways. For me, it's often apparent in the way we frame things, the word choices that we use. There's also challenges in working with non-traditional communities. Many times what we see is that empowered communities do participate, so we're not always getting the voice of those communities that are invisible to us. Sometimes those communities that we actually need to hear from are the ones that are the hardest to engage. Initiating a project with a community and developing a community advisory board can be challenging, and also overcoming competing priorities and institutional differences. The text also provides some examples of how to address these challenges. I've listed the key ones on the next two slides: engaging multiple stakeholders, establishing a MOA, knowing the history of your community. And for this one, I would say it's almost always key to partner with people that are part of the community and not just try to understand the community from an outsider's perspective, because that just rarely works. Allowing extra time that's needed to build community relationships. Being a regular presence in the community. So that's attending community events that are already scheduled and engaging with community members outside the context of your research protocol. Sharing knowledge with communities. Talking about your project in a way that is meaningful to them, and making sure that that communication channel is open well after the formal project ends. That's very important. There are a few more ways to address these challenges that are presented on this slide right here. Acknowledging the obvious, acknowledging the power imbalances, the race, ethnicity differences, that can go a long way. Taking communication very seriously, keeping people in the loop. Sharing funding and resources with community members. Now this is a big one. Often what we find is when there are grants and we win work to actually work with communities to engage them in research, community members are rarely reimbursed at any comparable type of level as a researcher would be reimbursed. So finding an appropriate level to compensate community members and not to think of them simply as volunteers when we're getting paid to do the work, I think is a really great way of addressing some of these challenges. Working with representatives that live in the area, I think that's another key one that sometimes we don't think about. Many times when we want to engage communities, we reach to community-based organizations, which is fine, absolutely fine. But the problem is a lot of those community-based organizations, CBOs, are actually staffed with people that don't live in the community. I mean, you think about it in this area, many of the folks that work at community organizations in DC live outside of DC, either live in Northern Virginia, perhaps they live in Maryland, many times out in the suburbs, don't necessarily know the community as well as you would want reflected in your project. Community advisory boards. Now, this is another tricky one. We have several community advisory boards at Children's. I'm actually co-chairing the CTSA Community Advisory Board with a community representative. And one thing that we've learned that was also in the text is communicating with our CAB requires much more than just the monthly, quarterly meetings. So it's a matter of keeping the CAB actively engaged in work that's meaningful and not just scheduling those meetings and having no work occur between those meetings. But then also realizing that our CAB members are not compensated the same way we are to work on these projects, understanding upfront what their roles and responsibilities are, how they could contribute, and helping them be part of the process of that planning is really critical. So now moving on to the next part of this lecture. As you know, this course is taught through the CTSI-CN, and that stands for the Clinical and Translational Science Institute. That is the institute that Children's formed with the CTSA award, the Clinical and Translational Science Awards. A lot of times people get those acronyms confused, so just want to point out that the institute is what was formed at Children's with the CTSA award. The CTSI is a partnership between Children's and GW. We're entering grant year 3 of that award. And in grant year 2, we had the opportunity to apply for some supplemental CTSA funding. And that's what I want to spend a little bit of time talking with you about. So before I get into the specifics of the CTSA supplemental grant, I want to give you some background. In early 2010, we at Children's had just finished conducting our first pediatric community health needs assessment, CHNA. And we wanted to develop a way to share the information within the CHNA with our communities. We held many forums and focus groups, and what we consistently heard through all of this community input is that community-based organizations were either unaware of the CHNA, and when they were aware of the CHNA, they didn't know how to interpret the data. Also, we were told that the data were quite dated. So we decided that one great approach would be to create a living, continuously updated source of online pediatric community health information. So essentially taking that CHNA and making it a living CHNA so the information is updated, it's available online, web-based, was the goal of ours. So we looked around for a software solution. We ended up collaborating with a company called the Healthy Communities Institute, which is in the business of actually building these types of collaborative websites. And you may have seen some of these sites. I know I talked about these sites in one of my previous lectures. But essentially what this portal or this website is it's a knowledge and collaboration tool. It's a dashboard view of community health, a lot of metrics. It tracks community health metrics. It shares community information and best practices on how to work with communities, how to address community health concerns, and also provides community-based organizations with resources to move just from the data to funding to actually action as well. So this was our goal. We wanted to take this children-sponsored community health needs assessment that was pediatric specific and create an online portal of this information. At the same time, we had learned of an opportunity to apply for some supplemental CTSA funding. We decided to go for it. We partnered with the only other CTSA in DC, the Georgetown and Howard CTSA. And you can see on this slide that every institution was able to submit 3 applications, so every CTSA. There were 12 interested PIs who presented ideas. 3 of those ideas were selected, and one, our idea, was actually awarded. This process was really quite intense. Of the 12 different PIs, all of us presented our ideas to the CTSA steering committee. We were scrutinized in front of everybody, but it was a lot of really good discussion, and we were we felt very fortunate that our project idea was selected. Our project really was to take the Pediatric Healthy Communities Network portal, which we had just started developing, and actually broaden that to encompass all DC populations. So we went from pediatric HCN to what we're now calling the DC Healthy Communities Network, from pediatrics to geriatrics. We believe that we won this work because of our true community focus. We had 2 aims. Specific aim 1 was the development aim. It was to develop the community-driven knowledge dissemination portal, the DC Healthy Communities Network, for the District of Columbia in partnership with community-based organizations. And the key here is we were really creating a tool that was community-driven and including community members and organizations on the front end of development, not simply retroactively to help evaluate the product or help us disseminate information. The second aim was also, I think, quite innovative. We proposed to develop a culturally and linguistically competent social marketing strategy to ensure that our site, the DC Healthy Communities Network, was adopted and disseminated and had as much impact as possible with our communities. So we proposed to develop innovative and tailored social marketing strategies to promote optimal utilization of the DC Healthy Communities Network site. For this aim, we actually subcontracted out to a social marketing firm that works with nonprofit organizations, Vanguard Communication, to help us in this work. Again, just noting that we really did work very closely with community members in developing the DC Healthy Communities Network site. We conducted community forums, several community focus groups. We have a community evaluation plan. We are developing a community listserv, community survey, and just mechanisms for community feedback throughout the entire process. To best understand what the DC Healthy Communities Network site could look like, I think it's always easiest to look at an existing site that another community has used. The San Francisco community has a very comparable site built by the same institute, the Healthy Communities Institute. It's called Health Matters in San Francisco. And what you see on your screen right now is a screenshot of their site. When we had our community forums and our community focus groups, we showcased the San Francisco site and a few other sites to get community feedback on their perspective. You know, what does the site look like for you? Do you like how the information is organized? Is it aesthetically pleasing? How is the navigation? And we actually had 4 focus groups and 1 large community forum, and we synthesized all of that information. And really the summary version was that they felt that the site contained good information, but the navigation was quite difficult. The site was really too busy. They wanted the site to really reflect the DC community. And by DC community, they were very clear that it was not the images that we typically see of Washington, D.C., the Capitol, the White House, the monuments. They really wanted the imagery to reflect the communities of D.C. So that was really important to them. Aside from that, a lot of it was simplifying, saying that we don't really need this much information on one page. And looking at the San Francisco site, we wouldn't even really know where to go. So what can we do to simplify and add clarity to this? And things like making the font size a little bit bigger. So we synthesized all of that feedback and we provided that to the Healthy Communities Institute, and they're actually working right now, as I'm recording this lecture, on developing the DC Healthy Communities Network site that incorporates that feedback. But you can still get an idea from looking at the San Francisco site that there's a community snapshot up front on the different health indicators that San Francisco has chosen as important to them to showcase. You can then see that you can click into any one of these indicators to get more information. I'll show you what that looks like. The navigation is on the left-hand side. There's a local feature story. There's a community survey on the right-hand side. So this is just a flavor of what the Healthy Communities Network site would contain. If you click into the metrics on the San Francisco site, this is what you would see. You see a list of metrics, and then you see visual dials for the health indicators. There's been a lot of research done about how to best present this type of metric information to lay communities and individuals not trained in research and healthcare. And the dial seems to work typically pretty well, whether you're in the green or the yellow or the red, pretty easy for people to understand. All of the data within the Healthy Communities Network site currently is based on existing secondary sources of information, and the idea is we aggregate all of the secondary sources that are out there. And we're talking about things like Department of Health data, census data, the CDC surveys for our area, things like that, data that already exist and that have been collected. And then after we actually aggregate all of the secondary data sources, we would then be able to work with our community members to ascertain what data gaps are there to fill and how are we going to go about filling that. So maybe at that point we would embark on some primary data collection. If you click into any, you get information specific to that metric. So you get to know where the source of the data is, how that community ranked. So you see right here that adults unable to afford to see a doctor, San Francisco's in the green, so that's great. You see what the legend means. So there's detailed information that's standardized for each of the metrics. What's also really nice is the information about the metric is then connected, and you can see this on the right-hand side, to other local resources in the community. So it's connected to news that's related to this metric. It's connected to resources within the community that's connected to the metric, promising practices. So all the information is kind of pulled together so people can see the information in one place in the sidebar. And then another nice part of this portal, which we are actually updating the look of this web page because I think it's quite bland as it's presented in San Francisco and hard to read through, but the idea is great, is that when you're interested in a metric and you see how you're doing in the District of Columbia, you may then think, well, what are other communities doing differently than DC? How do they rank compared to us? What are some promising practices and programs? So there's a part of the website that actually lists promising practices and actually grades them on what works better. There's some established criteria as to whether a practice is an evidence-based practice, an effective practice, or just a good idea. And so all of the promising practices are listed on this page right here. So our community-based organizations not only get information on how we're doing as a community with certain metrics, but also what promising practices are available related to that metric. So now our question is, we've involved the community in many ways up front and throughout the process in developing the DC Healthy Communities Network. We have received very positive feedback and a lot of excitement and enthusiasm about this product. But the question really is, how do we sustain involvement? What do we need to have in place? What do we do to make sure that some of the challenges that were described in the text and also earlier in this lecture, that we are able to address those challenges, and we're thinking about that up front rather than retroactively trying to address the community engagement issue. So that's part of the discussion board question for this week. Keeping communities involved in this portal and this tool. Ideas that you all have based on what you've learned through this course and maybe through your readings about how do we really keep the community involved. So again, please remember to participate in the discussion board assignment. We do expect that everyone posts their first response by 11:59 p.m. on Saturday night of that week, so of this week. And then also comment on 2 of your peers' postings by 11:59 p.m. on Tuesday, the following Tuesday. So thank you very much for listening to this lecture, and I look forward to a great discussion on the discussion board. And as always, please feel free to email me directly if you have any questions about the course and specifically about this lecture and the Healthy Communities Network tool. Thanks very much.